transforming remote healthcare with an advanced AI-powered platform that leverages ECG data to predict and diagnose chronic illnesses? That's the mission driving our next guest, Chris Darland, CEO of PureBridge Health. With over 15 years of global finance and operating experience across multiple industries, including healthcare, Chris brings a strategic mindset and a proven track record of delivering results. While together, Chris deep dives into PureBridge Health's pioneering work, harnessing the power of ECG and AI to revolutionize cardiac care and how their innovative device, PureBridge Core, is bringing hospital-grade cardiac diagnostics into the home, enabling early intervention, reducing hospital visits, and ultimately saving lives. Join us as Chris shares how he and his team at PureBridge Health is unlocking the future of remote cardiac care. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Chris. Welcome to our podcast today.
Thanks, Mike. Happy to be here.
We're giving your passion and mission to transform remote healthcare with an advanced AI-powered platform that leverages ECG data to predict and diagnose chronic illnesses. I'm excited for this important conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast. You will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and Twitter in order to further the conversations occurring on this podcast. All right, Chris, it's almost time for our community to learn how you and the PureBridge Health team are transforming remote healthcare with an advanced AI-driven ECG platform that helps people with chronic illnesses live longer, healthier lives. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
I think before anybody jumps into the healthcare space, you've got to really lock in on what you call it the North Star or the why, whatever it may be, because it's a tricky spot to disrupt for sure. For a variety of reasons, it's of course highly regulated for good reasons because you're impacting patients. Lots of interested parties that you've got to deal with. So patients should always be first, but payers, providers, clinicians, there's a lot of people, regulators that you're all working with, and of course expensive to do all of this as well. So as you're managing all of this and you're talking to investors, like I can tell you, 9 out of 10 investors I talk to will say, hey, we're here to change the world. And then when you tell them that there's no reimbursement code for what you're building, they're really not so interested in changing the world at that point. So you're going to hear lots of no's and lots of people tell you, here's why what you're trying to do won't work. And you've got to just take that feedback and you got to keep pushing. So it's a silly for me. I have it written down and I read it every morning when I wake up in terms of why I'm doing what I'm doing. You have to believe it in order to fight through a tricky space.
Chris, thanks for setting the stage. You are absolutely spot on. It is a very complex, multi-sided, multifaceted industry. It's no joke to try to innovate and reimagine healthcare and bring new and innovative solutions to bear in the market. So to your point, keep being persistent in what you believe in and building, but you also have to be pragmatic and taking into account the realities of the healthcare industry writ large. Is this something that you as well, in regards to your culture and with your colleagues at PureBridge Health, is that something that you make sure that you share with them as well? You got to figure out the actual opportunity here to innovate within this complex industry.
That's exactly right. And when you think through this structure, almost everything we do, we look at in terms of payer, provider, health system, clinician, patient, and we make sure we're not going against any of them. They might not all be jumping for joy on a particular offering we have, but we're trying to work in as much of the workflow as we possibly can to make this simple. For like heart failure detection, it has to be simple for a PCP to do or simple for a cardiologist to do. And then you kind of start to stack indications on top of it once they get used to using potentially a new device that's already part of an existing workflow. So we're trying to be very, very cognizant of not trying to completely turn the world upside down in any short amount of time. But of course, our goal in the long term is to materially change the way you can diagnose and find some of these disease states.
Well, we're going to talk about all of that and more and how you're bringing to bear these innovative solutions and being able to help within those already established clinical workflows that are incredibly important, as you know, Chris. Don't fight against them sometimes. It's very important to also work within them. We're going to discuss everything happening at PureBridge Health and more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we are back with Chris Darland, CEO of PureBridge Health. Chris, thank you so much. Setting the stage on the front end of this conversation, an important way to set the stage. We have to think about all the complexities of this industry, what it takes to innovate with inside it. And of course, we're going to discuss all of the things that are happening in the PureBridge Health Camp and how you guys are going about doing exactly that. Long storied career yourself. We're going to talk about that. We're going to talk about the storied past of PureBridge Health, where you guys are today, and how you see things moving on into the future as well. As you know as well as I do, Chris, especially since the pandemic, we've seen innovation move at an accelerated pace in healthcare. And I think we're going to only continue to see that with some of the technologies and the innovations that are coming and bringing bear to market. But first, of course, Chris, we got to take this back. I know you were an investor at first. You came in, CFO, now here you are leading the helm. Got to understand how this all come to be in the first place for you to take the CEO seat. Then, of course, like I said, we'll talk and dive in the weeds on who PureBridge Health is first. But first, please set the stage. How this come to be for you to become a full-time operator at the organization?
Yeah, good question. So maybe going way back, all my family's from Kentucky. I grew up in Cincinnati. My mom and dad left Kentucky. We're the only part of the family to leave. My dad worked at GE's entire career. My mom worked at GE. My grandfather worked at the appliances park manufacturing line. My other grandfather did the HVAC. So GE was in my blood for sure. We grew up mostly in Cincinnati. I went to Miami University of Ohio, real close to Cincinnati there. And the next logical step was I'm just going to go work at GE because that's what you do in our family next. And I'd never traveled the world before. So the beauty of GE is I got to go see all kinds of different businesses. I was at NBC and Universal and oil and gas, healthcare in Europe for a while, jet engines, locomotives in Kazakhstan and Europe and South Africa. So I got tons of experience, and GE does a good job of throwing you in the deep end and kind of forcing you to learn very quickly. And by learning quickly, you're finding problems quickly you can go address. And of course, had fabulous mentors my entire time at GE. But as I kind of moved up the chain there, I knew I wanted to do something a little bit more entrepreneurial at some point. And I started making some early investments. One of them was in PureBridge. Earlier in its founding, I was sold on the mission and what the founder, Angelo Acquisto, was trying to build, and had the opportunity as we kind of looked at shifting the strategy from PureBridge from just remote ECG to some of these AI advanced diagnostics. I was asked by one of the major investors to come in and help steer that strategic shift. So it felt like a perfect mix of being able to come in and have an impact. I think I couldn't have done it without my background at GE for sure. I think it taught me how to be a leader and combine it with my passion. And like I said, I can wake up every day seeing the people that I'm potentially helping as I kind of visualize the future of the company, and I couldn't pass it up. So lucky for sure to be in this position, a lot of responsibility, but I love it.
I would love to go back a bit and have a little bit of a side chat, because I think it's fascinating to hear that early on, years ago, you saw exactly the vision of what PureBridge Health was bringing to bear to the market. What got you excited about it to be an investor in the first place those number of years ago? What caught your eye? What got you excited about what the organization was bringing to bear?
Yeah, so the company started in 2013 by a brilliant pulmonologist from Northwell Health named Angelo Acquisto. He's in New York City. And although he'd spent his whole life in the hospital setting as a pulmonologist, it was actually his dad being in the hospital and tied up to a bunch of cords that for the first time made him sit back and say, like, this can't be the way. This can't be the best way, as he kind of struggles to get up and go to the bathroom, as many people probably had similar experiences. So he said, we're going to go out and we're going to figure out how to get all of these vital signs remotely. A somewhat novel idea in 2012, 2013. And that's the path he set down, is we're going to do hospital grade monitoring anywhere in the world at any time. And that's still our vision today, with a slightly different angle with some of the tools that we have from an AI perspective. But he spent the next 5 or 6 years building the remote ECG device, which is still the foundation of the platform we have today. So it's a 3-lead ECG device that there's an adhesive, you put it right on the center of your chest that has better ECG signal fidelity, both spatial and spectral fidelity of anything in the market. And then this next phase that we're really excited about is, all right, can you take that signal fidelity and now do things more clinically useful than arrhythmia detection, which a lot of devices are really good at. And quite frankly, even some consumer wearables are getting quite good at. So it's really about increasing the clinical utility and bringing his full vision home of true hospital grade, clinically actionable is incredibly important to us, monitoring home.
Chris, let's also talk about, because you've obviously just set the stage about who PureBridge Health is and what you guys are bringing to bear in the market. Help the community that may not know this world like you and your founders do. Give us a little bit of the understanding of the sheer magnitude of the problem out there. And of course, therein lies the opportunity for a PureBridge Health. What is going on, kind of large with society and the problems that we are facing that your company can solve for?
Yeah, so we're focused primarily on the cardiac space right now, which is the biggest driver of death in the United States and globally right now. And the problem, we'll start with heart failure because that's one of the big trials we've started with. The problem is we're not catching it early enough. And in the case of heart failure, let's say there's 6 million people or so in the US with heart failure. 1 million people get diagnosed with heart failure every year. 800,000 of those million, they're getting identified in the ER. And if you get identified in the ER, then the chance of readmission is over a third. The chance of living another 5 years is less than 50%. It's just too late. And the reality is that we have the tools. We don't have the time and money to go find it earlier. And what makes heart failure even more tricky is that you don't just have heart failure. There's usually a lot of comorbidities that come along with it. And the symptoms will look something like aging symptoms. So I have shortness of breath. And I always picture my dad. So my dad going upstairs. You have shortness of breath. It's him saying, yeah, it's because I'm old. I should probably exercise more. I should probably eat a little bit better. Are you going to go tell your primary care physician that, hey, I should go get checked out for heart failure? So I think a lot of people, it's not a lot of self-reporting maybe of these symptoms because they don't feel completely egregious. And then the process of getting diagnosed for heart failure is quite tricky and can take several months because quite frankly, there's not enough cardiologists in the country. I think they're getting a little bit burned out through the administrative burden largely. So the cardiologist count's going down, bed count is going down, cardiac disease is going up at the same time. So even if you want to see a cardiologist, it could be a 3-month wait and then you go and see them. And the next step is most likely an ultrasound or an echo to get a better view at the heart. And then there's a 2 to 3 month wait to go get the echo. And as you can imagine, some of this, I picture it, it's kind of like a dentist, right? If you go in and schedule a doctor's appointment and they're like, well, what are you doing? So this is May. What are you doing in August? And you're like, well, I don't know, sign me up for August 3rd. And then you get there and it's August 2nd, but you have to go pick up your kids from school. So you reschedule it and it's 2 months later. So it's just very burdensome. So the goal of everything we're doing is we got to find a way to very inexpensively and remotely have tools to identify the same things that you need these hospital tools for today. And I think we found it, which we're really excited about.
And in regards to those tools, and of course, Chris, right now we're in this period of time in regards to technology innovation and specifically around artificial intelligence. It's just coming at us in our own personal lives. And now, of course, now in healthcare, it's a lot of inundation around this notion of artificial intelligence. What does AI mean for PureBridge Health? What does it mean for the end consumer? What does it mean for the provider, et cetera? What does it mean at a higher level and maybe in simple terms for what you guys are trying to achieve?
Yeah, so I think AI gets used very broadly a lot and can mean a lot of things. So for us, the way to think through it is we're not using large language models or any of the ChatGPT type work. We're not using deep learning models, which rely on a lot of data going into a system with an output, a lot of times a correlation coming out. We're using more machine learning principles when in reality are 20 plus years old. So it's not like some of these tools just came to life in the last couple of years, although scalability is much better. So what we do is we can take the device output, the ECG comes through, it's a 3-lead device. We then have some tools that can translate that into a 12-lead type output. So the same thing you'd see in a hospital. And then for everything we're looking for heart failure as an example, we start with a hypothesis of this is what we expect to see in the ECG that helps us detect heart failure. And then a lot of the machine learning tools, I think about it more like fine tuning. You'd say, all right, is it this angle? So the different leads give you kind of different angles of the heart. Is it the V2 lead? Is that what gives us the best picture of the ST elevation, which is, a portion of the ECG morphology? Or do we get better results if we look at the V4 lead or lead 2? And is it this part of the ECG that's really most important? Our research thought it was a different part. So you can compute all of this, relatively quickly to help flush out kind of what is most important. But you have to start with the base research, which interestingly enough, some of this, the base research was started in the 50s and 60s. Just the tools didn't exist maybe at that time to really vet it out, but it was closer than maybe we even thought back then. And you're using these new AI machine learning type tools to really find what the key is in ECG to unlock some of these disease states. And I think the approach we're taking commercially, we felt is quite important because there's a lot of skepticism on AI for sure. So as we've gone through and done some of these trials and talked to our PIs and talked to some customers, us being able to go to the cardiologist or the EP or go to the patient and say, we detected heart failure and here's exactly why. You maybe can't see it with human eye only because it's over 3 minutes and it's 12 different leads and rhythms are really important to what we do. But here's the science that we base this conclusion on. And here's how it matches up with a patient, or hopefully doesn't match up with a patient at all, which I think is important to inspire confidence that it's not a machine doing the work. It's actually, supported by R&D and physics, which then can be kind of a superpower, I'd say, for the cardiologist. In no way are we trying to replace cardiologists or EPs and all the work they're doing, but how do we give them more tools to see more patients and have a bigger impact? We think it's important.
Well, let's also talk about, Chris, on the front end. You mentioned it because you set the stage on the front end of the podcast in regards to making sure everybody that is trying to innovate within healthcare deeply understand each stakeholder in the industry, whether it be a payer, a clinician, a patient, a health system administrator. Can you share a bit in regards to what the feedback has been from those stakeholders? What are they seeing and how are they experiencing the technology? What's the feedback that you and the team have been receiving from those stakeholders along the journey?
I think excitement and a wait and see approach. So all the trials we've done so far have been 40-ish patients. So we start with the hypothesis. We go out and we do it on 40 patients prospectively to say, hey, is this marker the right one? And then the next step with the FDA, which will start for ejection fraction in the early summer, is we need to go do it on, let's say, 800 patients, most likely for a lot of these. So until we do those 800 patients, we can't put this into the field, rightfully so, because we need the FDA to be comfortable with the conclusions that we're coming to. But I think excitement is there, and for different reasons for everybody. So if you talk to a payer, their view and the story that's compelling to them is ECG is inexpensive, which is fantastic and can be sent anywhere in the US, with the biggest cost for us largely is the cellular chip inside it that's sending data over AT&T and the shipping. And if we can avoid for a particular patient the $15,000 ER visit that is most likely going to find the heart failure, that's meaningful for the payer. And of course, everybody benefits in that scenario. And what we're working on a little bit with them is, but you can't do that for everybody. Like, it wouldn't make financial sense to send it out to everybody 40 years and older in the US to do screening, but patients over 65 with a BMI of X who maybe have hypertension, then you're starting to get to the level where, like, yeah, most likely, 10 to 20% of those patients have potentially stage B, so asymptomatic heart failure. And likely some subset of that have symptomatic heart failure and haven't complained or haven't found it yet. And that's when it starts to make sense financially. So our goal as a company is make this as inexpensive as we possibly can to still make money, to get the volume out into the market. And the more we can turn these and build some volume, the better, because heart failure is first. And that's what we're going to go through with the FDA. But we think there's actually a whole lot more potential on top of that.
And we'll definitely be talking about that in just a moment. Chris, let's also talk about, obviously, the one that should be in the middle of all of this, and that's the patient/consumer. And I know it's still early, Chris, but what's the feedback been in regards to patients, consumers having to wear the wearable device? Has it been a positive experience? We've had some fits and starts on a macro level around wearables and technology and what it means for our own personal lives. What's that feedback been thus far from those folks that have worn the device?
Yeah, so I think I may regret this in like 3 or 4 years if the strategy changes. But if you need to be wearing one of these wearables for an extended period of time, my point of view right now is you should probably be in the hospital. So this isn't meant for a patient who should be in ICU and you send them home. A lot of the diagnostics we're doing today require less than 30 minutes. So the idea is either in a waiting room, or in my dad's case, he's end of a long gravel driveway in Kentucky. You mail it to him, sit down, wear it for 30 minutes, take it back off, relatively mild adhesive, take it back off, put it in a box, send it back to either us or the payer or whoever's holding the inventory at that time. So we need to make it as simple as humanly possible. As we continue to go down the path of trying to do some of the hospital at home work, and there's some hemodynamic type measurements that we think we're going to be able to do with the device as well, then we're going to need to come up with adhesives that can potentially last a little bit longer, but still I view it as periodic type measurements. So the hemodynamic work, we'd want to be replacing things that are invasive today. And of course, invasive things aren't lasting for weeks at a time either, but can you check in on a patient for 10 minutes a day and have them potentially cared for at home as opposed to a hospital, which all the data, Cleveland Clinic's doing some early work here. A lot of the data is patients are going to heal better and be happier at home if you can find a way to get them care from their own bed as opposed to a hospital bed. So helping enabling that will be important. But I think the task of having somebody wear things for a month plus, that's a tough game to play. So the more power we can get out of periodic measurements, the better.
Love it. Thank you for that and better understanding how it engages with the patient in current state. Now let's take the crystal ball off the shelf. Chris, let's look a little future state. And I know you're still going through some of these trials, but what do you and the team envision, say 2 to 3, 3 to 5 years out for the company? And then of course, where are things heading for kind of the industry writ large? What are you seeing in that crystal ball at this time, Chris?
Yeah, so we're quite optimistic. Let's say if we were looking 3 to 5 years down the road, my best guess is we'd have 10 to 15 different indications that we could get directly from ECG, and not all of them are necessarily cardiac. There's interesting liver and kidney connections. There's some really interesting neuro connections that you can pull from patterns out of ECG. So we're always kind of thinking through what the next piece may be. And for us, compounding utility is really important because if you think through the payer situation and rural health, partially based on my background from Kentucky, is exceptionally important to me because these are people who largely aren't going to the doctor. And I use my dad all the time, definitely not going to the doctor. And there's not necessarily the best healthcare locally to reach them. So the more power we can get out there, and if you could do screen for 15 or 20 or 30 things in this 1 hour wear or 30-minute wear, we just become more and more impactful to communities that are maybe getting a little bit lost today. So I'm quite optimistic. I'm also pretty optimistic of the entire industry. I think the FDA has done a good job trying to lean in and embrace a lot of the change in AI. A lot of what we're doing is what they call software as a medical device, which is an important, I'd say, evolution of how they think through regulatory efforts versus actual hardware. So I think they're doing their absolute best. I think in terms of capacity, one piece that I'm really interested in seeing adopted is some of the ambient listening that you can do with clinicians to be able to give them a little bit more time. I think the biggest complaint, which isn't even cardiac focused from most clinicians I talk to, is just burnout and the amount of administrative effort that they're spending not caring for patients. Because at least in the cardiology space, the women and men who become cardiologists are spending 15 years in various levels of school, ultimately an investment to save patients, and they get tied down with paperwork. So I think there's tools like we're building will help, but a lot of really fantastic companies building tools that can reduce the administrative burden as well. And those seem to have pretty good adoption. And at least the way the community's thinking about it today, similar to how I kind of framed up our device, I don't think anybody's trying to replace doctors for sure. But to the extent that you can give them superpowers, one of our advisors kind of alluded to like, hey, you can use AI like a fellow or somebody who's working with you. You'll listen to them, but you're not going to let them make the decision for you. So you use your training, but how do you give more superpowers effectively to these clinicians to help them care for patients more? I think I'm pretty optimistic. Everybody I'm talking to seems to be embracing it, of course, with caution, because there are patients' lives at stake in some case, but I'm excited.
Well, Chris, you gave me an open invite to grab my soapbox. I'm going to bring the soapbox.
Go for it.
Stand on it for just a moment. I couldn't agree more with you. I'll be honest with you. I'm tired of hearing naysayers in the community saying that, oh, AI is going to replace our clinicians. There is no way in God's green earth they're going to replace our clinicians. Why? We literally do not have enough human capacity to take care of the needs that we have across the industry or across our communities, across this nation, and more broadly, the globe. We do not have enough human capacity. So to your point, if we can offload some of those lower acuity type of responsibilities to the machines and allow our clinicians to work top of scope, to me, that's a home run. And to get them back to the most sacred thing that they're so good at, that clinician-patient engagement, that's what we need to be focused on. So Chris, I have now stepped off my soapbox.
Perfect. Couldn't agree more. There's an article, it's perfect time. There's an article today that I read, like 20% of all clinicians plan on leaving their career in the next 3 years. And I'm just thinking to myself, like, they're not leaving because they're tired of patients. At least in cardiology where I spend all my time, that's their passion. That's what they want. And they want to help. And even as I work through reaching rural patients, in their mind, those are people they can help that are outside of their reach today. And if there's a way I can bring them in, then that's what gets them excited. So we got to enable these, effectively in the cardiac space, heroes for sure. We got to enable them to go do their job and everything they're trained to do.
Bravo, my friend. Couldn't agree more. Well, we'll put the crystal ball back on the shelf for a bit, right next to my soapbox that I just pulled off the said shelf as well. Now let's get back to current state, Chris. As I mentioned to you, as we're getting ready to record this episode, we have an incredible community rallied around this podcast. Some of our best leaders in the industry tuning in and helping our guests out just like yourself. What's one problem, need, or question that you and the team have that our community can be helping you with?
Our biggest need is always partners in executing on research, for sure. And being a startup, it's doing it in a very budget conscious way. So to the extent there's people out there listening that enjoy research and would like to be a part of any of the trials, and as we think through some of the forward work that we're doing, please absolutely reach out. The flip side of that coin is trials and research can be a little bit expensive. So we're not actively raising money right this second, but we likely will be by the end of the year. So if there's any investors that are excited about getting into the cardiac space and kind of embracing the tools that are up and coming right now in the AI space and leveraging ECG, please, always happy to talk and kind of walk through what we're building and how we see our future as well.
Excellent. Well, that sounds great. Chris, in order for the community to help you and have those conversations around what you just shared, how do they get a hold of you? Social media handles, websites, contact points online, or otherwise, how do they track you down?
Sure. PurebridgeHealth.com is probably the best place to start. And there's a little contact info at the bottom. We have a LinkedIn page where we put a lot of our press out as well. And feel free to email me as well at c.darland@purebridgehealth.com. Always happy to talk to anybody who's potentially inspired to be a part of the healthcare revolution we're undergoing. I can always make time. Anybody who thinks they would be interested in partnering, of course, I'd love to talk as well. Don't hesitate to reach out.
And for our community, go ahead and simply scroll on down into your favorite podcast player where you're listening to this episode. Get those contact points for Chris and the team. You can head over to our free global online community as well at passionatepioneers.com. There will be a post for Chris's episode as well as an area to leave comments, feedback, questions, or otherwise, and to get those contact points online, again, over at passionatepioneers.com. Chris, this has been an exciting time together. Thank you so much for taking a pit stop to be with our community and sharing all the wonderful things happening in the PureBridge Health Camp. And thank you for letting me pull my soapbox out for a moment. That was fun as well. So thank you for that.
Absolutely.
But before we sign off, Chris, we have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
there's 40 million people in the US who are counting on me to be. That's the impact. And that's what we push with the team every day. That's the impact we can have. And that's what I think about. Those are real people and the responsibilities on me to help bring the relief.
I love it. Awesome. Chris, thank you so much for bringing it all together at the end. Thank you again for spending time with our community and being on this podcast today. Wishing you all the best. We look forward to continuing to follow the journey. But for now, thanks again for being with us today.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.